What's the strangest thing you heard someone stick up themselves? Find out more on this episode. Hey, what's up, guys? It's Confessions of a Doctorholic with Dr. Slayman. Just got off of my nights. That's probably why I sound a little bit sleepy. So 8 p.m. to 8 a.m. Bit of madness. Few screams, few naked people. Some people with dementia. Heaps of lorazepam. And basically, what I had to do all night was become a clerking monkey. And what that means is that after the emergency medicine physicians have seen the patients, I go in, I get my booklet, and anyone that's a medical patient, so like not for the surgery department and not for anywhere else, I literally go in, I ask them questions about their presenting complaint, history of their presenting complaint, their past medical history, I look at some of their old notes, I look at the medications they're on, and I do a quick examination. Sometimes I ask them about their dementia and I do a baseline screen. And then I write down my differentials and a treatment plan. More often than not, I agree with the emergency medicine physician. Sometimes I might add a few extra tests if it's like ongoing confusion to try to investigate that so that we have a plan for when the person's admitted. So, last night I had an interesting case of someone having bowel in his scrotum. I looked at this patient with the surgery reg. Basically, he came in with burning sensation and like a classic UTI symptomology. He was quite unwell, he had low blood pressure, he had a fast heart rate, and he was spiking in temperature. So surgery reg went in and he was like, well, his main issue is the UTI. We need to treat his urinary sepsis. The hernia isn't the main problem. It is a chronic hernia situation. The patient had it for years, hasn't been complaining about it. It was quite embarrassed to come in with that massive scrotum, so we can deal with it as an elective surgery. To which I was like, what about strangulation? Because that's what I was thinking of. And he was like, well, if it's strangulated, you would see a extremely tense scrotum, which is extremely painful. The patient is extremely unwell in a different way. Basically, has signs of bowel obstruction, so vomiting, constipation, and a tense abdomen. So we dealt with this patient when I asked the reg, do you guys have anything interesting happening tonight? And he just gets this phone call. Then he turns to me and with a straight face says, don't know if this is interesting for you, but basically, not a super common case. Sometimes you find foreign objects inside people, and we have a patient with that. So I went back to the emergency department to hunt for this second surgical patient, and sure enough, presenting complaint, vibrator in rectum, examination, abdomen, S&T, which basically means that the abdomen is soft, non-tender, and it's like a normal abdominal exam. That's exactly what you want to see. Chaperone declined. I don't even know why. Like, was it that we can't do any more damage? Who knows? PR, no bleed. Vibrator felt. Smooth, nothing to hold and retract. Buzzing sound could be heard. They tried fishing it out during the rectal exam. Couldn't do anything about it. So he was admitted to the surgery ward. And now he's awaiting surgery. So the day team, they're probably going to sedate him and fish it out. What do you even do? Do you give it back to the patient? Is it a good memory? I don't know. Have you guys heard of something equally as insane? What is the strangest story that you've heard? What is the strangest foreign object that you know that's been swallowed or inserted in someone? Please message me. Please send a voice note. I want to hear from you guys. And I hope you enjoyed my little story. Have a good one.